Hello, welcome to yet another video of Yoni Academy. Dear community, we have started discussing with the Bahya Srotas, or what we can say natural orifices present in the human body. Initially, we have started with asya or mouth, later eyes, then nostrils, then ears. After that, we have started with anus and urethra. Among them, the first seven were present in the upper part of the body, head and neck region, and the last two are present in the pelvic region. Today, we are going to discuss the orifice which is present only in the females, that is, yoni or vagina. When you think about this particular part, which is present in the antaradhi, that is the part present in the head and neck, in between the head and neck and the lower limbs. This is seen in the pelvic region. It is considered to be one of the Bahya Srotas present in the females. This is actually responsible for the expulsion of artava, or what we can say the menstrual blood, which is expelled through the vaginal route, which is formed in the uterus. And it also becomes the receptacle for the phallus, that is the erected male sexual organ during the sexual intercourse. When you think about the normal functioning of this particular part, is mainly related with the apana vata. If any kind of the disturbances in relation to apana vata, there may be a possibility of either excessive menstruation or scanty menstruation or painful menstruation, or muscle cramps may be observed, or lower abdominal pain or lower back pain or pain in the inner side of the thighs, or the lady may be presented with white discharge per vagina with itching, etc. So these are the different presenting complaints that may be possible. So as far as the Dalhana says, Shukra Mutradina Vekakale Karma Karanam and Avekakale Dharanam. When the person is having the urge as such, then there will be the proper expulsion of these urges from the body to the exterior. And when the person is not having any kind of the urge as such, the retaining of these substances in the body is the main function of this, what you say, that the apana vata. In case of the uh, this artava, when the lady is having uh, the actual menstrual period time, so that will be leading to the proper movement of this menstrual blood from the uterus to the exterior via vagina. And when the lady is having the past the stage of the menstrual phase, so that will be associated with the, what do you say, that proliferation of the blood vessels in the uterine myometrium. This is the functioning of, what do you say, that the apana vata as such. As far as the functional anatomy is concerned, so this is what we can say is considered to be the what do you say, that the area of, what do you say, that the ovum production. From this particular part, so this released ovum will be entering into the uh, uterine tube. Here, there will be the possibility of, what you say, that the zygote formation takes place. During the sexual intercourse, the sperms are released at the this particular cervix region. From here, it may enter either to here or to here, depending upon the uh, movement as such, that will be moving into that particular direction. And when the ovum is released, either on the right side or left side, So that will be picked up by the fimbriae present in the uterine tube, wherein the ovum will be entering into the uterine tube, and at that particular uterine tube level, there will be the formation of zygote. After the zygote formation, this ovum will be entering into the uterus and gets implanted in the upper part of the uterine segment. That is normal. And after the proper formation of the fetus, this particular fetus will be expelled via vaginal route. What we can say, that the process of a parturition. If the zygote formation is not being present, so that will be coming from the uterine tube into the uterus, so that will be expelled along with the uterine, that the necrosed uterine capillaries, etc. So that will be eliminated via the cervix, from there to the vagina, then to the exterior in the form of menstrual blood, which will be cyclically released from the uterus to the exterior. This is the picture of that the cross section of the female genital tract as such. This is what we can say the vaginal orifice, that is the vaginal tract, and this is what we can say the uterus as such. As far as Nidana of Yoni Vyapat Vikara, Adivyavaya. So that is excessive sexual intercourse that will be leading to the entry of the pathogens into the vaginal route, thereby that may enter into the uterus, and then that may enter into the uterine tube as such. That is what we can say leading to pelvic inflammatory diseases. Improper administration of Uttarabasti. So that is, the no proper precautions are being taken for the preparation of basti material, and when that is being prepared, no proper precautions are being taken regarding the pre-operative procedure of the Uttarabasti as such. So that may lead to the the disturbances in relation to Yoni. So here the administration of the medicines will be done through vagina. As far as the surgical aspect, surgical damage, there may be a possibility of the surgery, so which may have an impact on the the urethral sphincter. Thereby there may be a possibility of damage to the vaginal orifices also, such as during the episiotomy. Then comes the Tikshna Ahara or Snigdha Ahara consumption in excess. Sexual perversion, such as insertion of sexual stimulators into the vagina, and vihara such as Shoka, Vyayama, Shita, Vata Sevana, etc., which in turn is responsible for the stimulation of the sympathetic nerve stimulation. Thereby, the secretions of the vaginal tract that is going to get reduced. As far as significance of the Yoni is concerned, this may be become the source of the entry of the pathogens via contaminated water, etc., or Uttarabasti administration through the vaginal route, as we have discussed earlier. If that is not being done properly, not following proper standard operative procedures, then that may lead to disturbances in the Yoni itself or vagina, wherein the source of the entry of the pathogens will occur through vaginal route, which may damage vaginal mucosa, wherein the lady may be presented with the presenting complaints in relation to vaginal orifices or vagina as such, wherein there may be a possibility of inflammation to happen in the mucosa of the vaginal passage, and thereby there may be a possibility of endometritis or otherwise salpingitis, etc. So that is what we can say. Inflammation of the mucosa will be happening of the female reproductive system. And when there is some amount of the pathogens are being present in the vaginal tract as such, so that may lead to inflammation of the vaginal passages, which is considered to be again the intracellular compartment affliction may be possible. The take-home messages from today's discussion are: the yoni or vagina is again one of the important Bahya Srotas present in the females, which gets afflicted because of the abnormal diet and regimen or the improper Uttarabasti administration, which may lead to the affliction of Artavavaha Srotas as such. The clinical presentation may vary from the pain during the sexual intercourse or to life-threatening bleeding from the vagina as such that will be manifested. This may be depending upon the number of pathogens entering into the vaginal passage or virulence of the pathogens entering into the vaginal passage is determining the severity of the symptoms produced in the body. Hence, we need to identify the cause and eliminate the cause to get the symptoms subsided at the short possible time. Sushruta says, Sankshepatāh kriyayogo nidana parivarjanam. Dear community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this channel? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners or true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.